Within the last 8 years, the medical device industry has seen more than 100 companies focus technology and research development on solutions for the treatment of spine disorders.
Currently, in the spine community, in the academic setting, there is a lot of research being done on the effect of preoperative patient education and how that directly relates to a patient's overall outcome. What is being found and what entities such as the American College of Surgeons are finding is that patients who are comprehensively educated preoperatively are having an overall improved experience with an expected improved outcome.
The world of spine care is rapidly changing with the development of new technologies that provide better outcomes and more expedient recoveries for patients. In the United States and globally, hundreds of companies exist that provide products, implants, and devices for the treatment of spine disorders. With the vast amount of product available to surgeons and healthcare providers, it is crucial that patients understand the broad spectrum of treatment options available to them.
Being a chiropractic physician, my main focus is patient education. I believe that it can be a challenge for medical professionals to keep up with the development of new technologies, and for patients, I believe that it can be a daunting task as well.
It's no secret that the general public is very limited in their access to understanding about spine technology. There are some great websites that provide excellent information, but a lot of times patients, if they're Googling a certain term about a new technology, whether it's pedicle screws or minimally invasive procedures, they get hundreds if not millions of results, and trying to narrow that down into understanding what the specific technology is can be a very cumbersome task for the patient.
A revolutionary patient education-centered company is making sense of all spinal technologies currently used in spine treatment. SpineOtec Consulting invites you to discover a novel approach to technology education for patients.
With SpineOtec Consulting, I wanted to create an environment where a patient could be comprehensively educated in a one-on-one, face-to-face consultation with somebody who's experienced in using technology in spine surgeries.
Annually, there are over 1 million spine surgeries performed, including microdiscectomies, spinal decompressions, and spinal fusions. A patient who was recommended for an anterior cervical discectomy and fusion comprehensively learned about his technology options through services of SpineOtec.
Several months ago, I realized that what I'd been experiencing for quite some time, some general pain in my neck, headaches and all, was intensifying. And I also began to have some symptoms on the left side of my body, my left shoulder, left arm. Primarily tingling, numbness was developing. And although I had felt it occasionally at times past, it was really intensifying and was something that was with me all throughout the day, throughout the night. It was just a few months after that happened that the onset of really severe pain hit me, really almost all at once one day. My primary physician and a surgeon both were in agreement that surgery was inevitable for me. By nature, I'm an individual that likes to have a lot of information, particularly when it has to do with my health care. And so I wanted more than just a doctor that would say, hey, we're going to fix you, everything will be okay. I wanted to know what was going to take place, what was going to be placed in my body, what the outcome would be, what long-term prognosis was. So I had a lot of questions at this point. You can do some research on the internet and various different places, but to me, two things happen there. One, you get information overload and it almost becomes more confusing than helpful. Secondly, I don't always know where can I trust, what websites can I trust, what information is trustworthy.
SpineOtec Consulting exists to educate patients on the entire spectrum of technology that is available for the treatment of spine disorders.
SpineOtec provides patients with a comprehensive way to understand all of their treatment options when it comes to spine surgery.
And so as I began discussion with SpineOtec, I discovered an incredible resource for me as far as giving me the information that I was looking for pertaining to my surgery. In that process, I was able to discuss the technologies, the surgery itself, as far as hardware that would be placed into my neck area. The SpineOtec offered me a variety of ways to see what was going to take place with me, some through computer graphics, others through spinal models like you see right here on the table, where it was actually explained what takes place in a spinal surgery.
SpineOtec strives to equip patients with the tools needed to make the best possible decision of what technology may be the best option for them. Focusing on a method never attempted before, SpineOtec offers face-to-face patient technology education. The ultimate decision for treatment will always be determined by the patient and physician.
SpineOtec really helped me with the face-to-face encounter where I was talking to someone, they were explaining to me, I was able to listen, ask a lot of questions. And something that was very intriguing to me, we don't often know what we need to ask our doctors. It's just hard to know what is appropriate to ask or where to even begin because we don't understand our bodies and what's taking place. And so SpineOtec in my personal consultation time really worked with me to have enough of an understanding of what was taking place in my surgery and actually suggested some good questions that would be asked. It would be good to ask my surgeon as I went and visited. Those questions were not only helpful in answering some of the concerns I had, but me being able to spend a little extra time with my physician and getting his input into what would be taking place.
If I feel that a patient of mine needs to be evaluated surgically, I also feel comfortable knowing that patients have a way to essentially prep themselves before seeing a spine surgeon. SpineOtec provides each client with a tailor-made set of questions to ask their spine surgeon.
SpineOtec's technology education facility provides cutting-edge materials and information, accommodating individual and group consultation.
So we really have provided a way for patients to understand everything and in a question and answer session so that they walk away feeling empowered and ready to make the best decision for themselves.
And so now as I look back on my journey of surgery and recovery, I see SpineOtec having been a key part of the team. So often we think of doctors and nurses and hospitals as the team. But in my view now, I've come to realize that maybe patient education has been a weak spot in the team process. And SpineOtec in that process, the process that I went through, has really helped to optimize my experience. It is my hope that as I hear of others that may need this type of surgery, that I can certainly point them in the way of SpineOtec and enable them to have the experience that I did in patient education.
To contact SpineOtec or to learn more, please log on to knowspinetechnology.com.